first of all, you mentioned that somebody was beautiful is so. I think the first thing I want to say is that all the lupus warriors are beautiful girls. As a matter of fact,
Off my hotspot.
I have a doctor friend. Anytime he's going to refer a patient to me, he will say, I have one of the customers, let me send them a cake. And also the fact that this
That one.
is
Yes,
not
yes,
village,
yes.
because everything is
The last, yes.
and that of being in diabetes. Let me thank
Wait, it's loading. It's
Bible
loading.
for
It's hungry there.
writing this book. It's always a tough deal having to write it. I've been on the textbook of rheumatology for the past 4 years, and it's just within the past 1 month that I'm seeing it's always tough, right? Because you go over and over again, something gets wrong, go back and correct it. It's always a tough. But at the end of the day, I think the product of your brain work makes you happy. Let me also thank her for being a lupus warrior. Lupus is a challenging condition. For so many years, the boss or what the medical data was writing was like rare. As a matter of fact,
Yes.
somebody came with some before still, like when they used to go to Africa, they talked one or two places, and they say, oh, lupus is rare in Africa, generally south of Sahara. And then as you move up north, across the Sahara, move to North Africa, you begin to see lupus. By the time you cross the Mediterranean, then you can see many more lupus. We all know, at least, I mean, I didn't know they got all lines. Most of the time, when we reported lupus, up till 1987, what was being reported were what's called case report. Case report means you see one case and you're so excited and they report it. Because for medicine, if you're not reporting anything, you can't say anything. You can only it's only when you publish that people take you serious. If you don't write anything and you don't go on social media or going on television and say this condition is common, no. Medicine does not accept that. You have to publish so that your peers would assess it and tell you either you are talking rubbish or that's a fact. So that was the situation until I think 1980. That 1987. I've been running the rheumatology clinic for 7 years, and for the specialist who manages the process called in rheumatology. It's a tongue twisting word, right? Amazing work. As rheumatologist means people with arthritis and rheumatism. And I remember somebody telling me anybody can keep arthritis. You need just to give them the But the fact is this, there are more than 100 causes of arthritis. So when the doctor comes and says you have arthritis, it's absolutely nothing. It's like somebody coming, you go to see a doctor, and the doctor says the diagnosis is headache. Headache are caused by 1,001. So, that was the situation until 1987, and we published. I mean, I and my two other colleagues of mine published in an international journal the first 66 cases of documented SLE in Nigeria. And that was the only time people started taking it seriously. Because I've known this for some time, but until it was published, nobody took it seriously. So when that was published, that particular publication is now one of the most cited. And for us in academics, you have to be cited to recommend. You must tell to win certain statement. It's probably the most cited on lupus in black Africans. Then just of recent, we also published our first 5,000 cases from a rheumatologist, private rheumatologist, and we had about 420 cases of lupus. So it is not rare. That is not the message. It's not rare. And like I said, it's such a mysterious illness. And I will to go through certain aspects of it all. What are the facts of lupus? Lupus is an autoimmune disease. Autoimmune disease is one of these mysterious in which the body's defense system, for some reason, turns its ammunition and becomes and whatever they are on with it. You know, normally our body is protected by what we call white blood cells. These are the soldiers of the body. And the soldiers are marching up and down. There's this right from our nostrils, that everywhere in the body, they're there. And like in all army, all military, they are programmed to defend us against enemies who are our greatest germs. Yes. And if you realize that every time you drink millions of germs, because cancer was again. Every time we eat millions of germs. Some of them are even our neighbors on our skin. We have staphylococcal bacteria on our skin. And once in a while, they break through and cause infection. So these white cells are going up and rounding off these germs throughout the day. From the day we are about to feel that. And they have different ammunition. It doesn't like the military. Those who have machine guns and machine guns, those who have jet fighters, different things. Some they even do hand-to-hand combats with the bacteria. But most of the time, they send some nuclear weapons to the bacteria and neutralize them. That's the way that's supposed to happen. For some reason, you don't understand. There are many theories, and once doctors have too many theories, some of these germs decide to gang on together and attack the body. And that is called what you call autoimmune disease. And autoimmune disease constitutes in trainers lupus is just one of them. There are so many of them. In my consulting group, I have
this is recorded.
That shows
Yeah, it's
120
recorded.
autoimmune disease.
No, it's recorded. It's okay.
That's quite
But check the
substantial.
chat.
So, these are autoimmune diseases, and that's lupus is just one of them. But unfortunately, lupus is probably one of the most difficult ones, either to diagnose or to manage. So now let's go back to the first slide, please. Okay, so that's what it is. Then it is most commonly seen in females. From our own stories, it's probably seen about 12 to 14 females to male. So I try to understand when Dr. Hamilton said his brother was affected. It will take a long time even to get a diagnosis because you don't see it in males. He's seeing more than females than male. Why? Because of the female hormone estrogen, which is important in the immune system. It affects females unfortunately, it affects females of childbearing age, those who are in the prime of their lives. But it can affect also children. Surprisingly, we have seen and reported what you call juvenile lupus. That's lupus affecting children, 17 years old. It is challenging disease. That's one of the major challenges. It can show up in any way, unpredictable. You can look at that show up anyway, anyhow. And abroad, every time physicians are confronted with a medical problem and they can't think their way through, they will say, calling the rheumatologist because this might be autoimmune disease. And that's what it is, because it can affect different parts of the body. Then it is a hydra, it is for those who study allergy. I want to cut off the head of one hydra, and I want to do so. And exactly that's what it does. You cut off one, you take one, the other one should Let's like it is characterized by flares. Flares means one new clinical features, that is new organ affected. You may start with the skin, and then you start to affect the kidneys, it affects the lungs. Then it requires, when we talk about a flare, we also talk about hospital admissions. We'll talk about the need for new or additional medications. Lupus is always in a flux, so that you keep on changing your treatment as it goes on. And all organs, any organ in the body may be affected. But commonly, in glass, is the kidneys we worry about. But it can affect the lungs, it can affect the heart, it can affect the skin, it can affect the joints, and can be unknown to many. One of the commonest causes of the current pregnancy losses. You get pregnant, you lose the pregnancy usually at about the 10 to 12 week of pregnancy, get pregnant again, back to back, back to back. So it even affects the child in the womb. Uh, Now, we talked about it being an autoimmune disease. The question is, how does the immune system work? Like I said, the immune system is supposed to be programmed to defend us against that. There are two major systems, and don't worry about the name. As you know, when people ask me, when patients ask me, how do you explain this in Yoruba? I don't have any Yoruba name for it, but there are two systems of the defense mechanism of the body. The first one is what we call the innate system. The innate system is the rapid response system. They encounter the bacteria or any germ, they rush it first. The white cells, they rush it. That is they are the first responder, or what we call in the US they call it the first responder. Here we call them the rapid response. They come in and try to take on the germs. They win sometimes, but when they don't win, they have to call on the backup. And the backup is the adaptive system. This is God in His infinite mercies has programmed the body so much that we only have to study it to know what it is. He has programmed, and that's why I think I keep on when people say, "Oh, what we did," I said, if you read the Bible very well, He said, "Go and subdue the earth." He God did not; it wasn't just subdue the army, subdue everything in between, subdue the diseases, subdue everything that is not for us. That's what they are seeing was it made to do so. So this is it. The adaptive system now comes in second. And when there is now dysfunction or disruption of this adaptive system, then we refer to that as autoimmune. Now, the adaptive system works on tolerance. Tolerance means the cells do not attack the body because they are able to tolerate themselves. They don't attack the body, they don't attack any cells in the body normally because they are programmed to do so. But when there is damage, then those cells that should normally be tolerant of the body now begin to attack the body. Why will the body behave this way? It's an abnormal behavior. But don't forget that the body also works with physical things. There are various theories for autoimmune disease. And let me try and simplify them. The first one is our husband. I call it our husband has done my again. For those of you who are familiar with it, that's collateral. Our husband has gone mad. The white blood cells, the defense system of the body, can go crazy. Usually, if they are affected, especially with this small germ called virus. If they're infected with the virus, they can go crazy and fail to recognize what's body and begin to attack it. So that's what I call the theory. Our husband has gone mad again. Then the second theory, again, simplify it, is area boy syndrome or cool plotters. Our body cells are developed incidentally also carry along a lot of cells which are what is called autoreacts. That is cells that normally, would react against. They are sitting down quietly. They're going around circulating with the good cells, but once in a while, again from infection, these cells now become crazy or they become activated because all along they've been quiet. It's like the area boys. Anytime there's a disruption in an area, the area boys are busy smoking their India and but you have any destruction around, they're going to come out and start attacking everyone. So in this particular instance, the area boys, these are the cells which are normally sitting quietly, circulating along with the good cells, but if there's any disruption, it's not. For those who are familiar with the Bible also, there was a particular verse in which the angels of the Lord went to meet him. And Satan also came along. And God asked Satan, where have you been old man said, I'm busy causing your all over. So these are all auto-reactive cells. Then the other theory is what I call the what was happening, friendly fire syndrome. If you remember during the Gulf War, American pilots were actually firing on American soldiers because those soldiers looked like enemies to them. So it was fire, but it wasn't really. It was friendly, but it was not. It was fire, but it's not a friendly fire because they were killing themselves. And then finally, the other theory for to explain this auto immunity is what we call apoptosis. Apoptosis means every cell of the body is programmed to die. The cells you had last week, not the same cells you have now, because the cells are dying again with the mix. Now, as those cells are dying off, they should be recognized by the body and disposed of properly. But oftentimes, when the immune system of the body does not recognize it, it attacks those cells that are dying and also the normal cells because they contain the immune system does not recognize intact cells, they recognize protein. Now, what is that? That's so. How do we? What are the steps we carry out? Locus because of its various manifestations. The major thing that we carry out is what we call the serology, the test to determine the antibodies that are circulating, and that's very important. So we talk about serology. We also talk about the various organs that are affected. The kidneys must always be examined, must always be tested because lupus tends to pick up the kidneys. So you have to test the urine, you have to test the blood, you have to do various entries. For instance, the chest is involved, and you can have fluid accumulating over the heart or fluid accumulating over the lungs. You have to do X-rays of the joints too. Sometimes you do what you call the ECG when the heart is affected. Ultrasound of the abdomen when organs in the tummy are affected, and all the other things are there. And next week. So, what are the challenges we face in the management of lupus? And not just lupus, in the management of all autoimmune, what are the challenges as rheumatologists? What really gets us more at mind? Well, poor understanding of the disease. Almost all cases that I've seen, and I must recognize my co-consultant, Dr. Olufemi, who has just one. Also a consultant, these are the ones who are carrying touch forward because I'm an old man now. Yeah. What are our challenges, which we all know? Poor understanding of disease. Oftentimes, when we see patients who have a spiritual attack, they are afraid, they are fasted, they are done all sorts of things. But it doesn't do because it is not spiritual attack. So the first thing you actually do, or the village people, and there always village people everywhere. In Africa, anything you don't understand, you have to call in village people. And there are so many village, because we're in the city, there are so many village people. But luckily enough, lupus is not common in the rural area where the villages are. So these are things we have studied, and we know that it is very rare in the rural area where the village people are. So what is happening? They are sending their arrows across all borders, all distance to cities. We know that lupus is actually common in the urban areas, and especially it's commoner in the southeast and south because of we think of pollution from oil and stuff. So environmental. Then the other suffers in and out of the hospital, various tests. I mean, lupus patients have been subject to virtually any test you can imagine. Then, non-advanced method, the appropriate blood test, you need a particular blood test to be managed.
No.
These are not ready that day. And when that can be, they're actually quite expensive. So non-affordability, and even then the medications themselves, unfortunately, as an last glucose will tell you, is a very capital intensive thing. You keep on buying drugs, you keep on doing all sorts of tests. Sometimes the patient will look at you and label you as being wicked because no sooner does the person raise certain money and then you have a flare and then you have to go and buy this medicine, you go and buy this, you go and do this test. So that's a big challenge. Unfortunately, the health insurance has not done that in the forthcoming because you must have a robust health insurance for them to factor. There's some of the HMOs that even tell me you just make the diagnosis, send us the list of tests, send us the list of medication. But unfortunately, we know that there are laboratories and there are laboratories, and we know the one that we prescribe. But unfortunately, oftentimes because the HMOs want to cut corner, we send it to the laboratory, and we just say we don't want that test to run it in our own laboratory because if you are asking me to treat, I'm not doing at least not also important. Then we're having another problem, and the issues of cancer declaration. Everywhere you go, there are cancer declaration. And they don't talk about management, they talk about cure. Now, for us, when you say somebody is cure, a cure means you take a drug for 1 week, for 1 month, or whatever. You are completely okay. And like I tell my patient, if you want to have a cure, that means no more doctor, no more medication. As a matter of fact, I said you can even abuse your doctor because you know you cannot see in that condition. But we need to let patients know that it's management. It's just like people have hypertension, there's no cure. If anyone tells you has the cure for hypertension in their life, and it's already saving you manage it. Many afflictions of mankind, unfortunately, we manage it. We don't talk as a cure. Then the adverse effect of medications themselves can be something else, but what we want to do, when patients come and they say, these are the side effects
Check if there's anything in the chat.
When you check, there's a possibility of some adverse effect, and every drug that we know that we use
Yes, chat.
has
Is there anything, any message?
it is important that whoever is administering the drug knows exactly what the adverse effect are. Knows how to prevent that, to manage it. But that's one of the challenges we face. Patients will say, I don't want to take the medicine because I've read it and there are so many Google doctors who go on Google and they will tell you they've read 1,001 adverse effects. And I will tell them that what the pharmaceutical industry does is not because you have those side effects, but because they know that if you have any of these side effects and you take them to court, you're going to clear them. Especially if you have a few people who have the same complaints and go to court, they're going to lose everything that they have. Then social media interference, you're not having another problem. Social media. So several months ago, a popular actress went on the air on social media and said that she was being treated in Louth. I happened to be a consultant in Louth, and that they asked her to pay 5 million, and they said she was going to live for 2 years or whatever. Nobody told her that. But social media, the power of social media, unfortunately, is causing a lot of havoc. Because anybody, and I mean it, any idiot can go on social media and say anything for content, and even say things for content. So when they say that, and people now react, and in that particular episode, I mean, I was asked, and we were thinking, but we just found that there's no point fighting on social media with somebody who has the intention to cause harm. So that's another way to invest it. So how do we manage the basic drugs that we use, anti-malarials? It's not malaria we are treating. recognize that drugs can be used to treat so many things. But you just find out that chloroquine and hydroxychloroquine, which anti-malaria, are quite effective. That is our number one drug that we use. Then we use steroids. Again, steroid has a very bad name. You say, oh, it's causes so and so question. But it's a matter of which one is better. And in any case, when properly managed, steroid just work for such harm. Then we have to use some drugs that ordinarily we use for treating cancer. And oftentimes, when we send the patient to go to pharmacy, an ignorant pharmacy, with due respect, will come out and show the person all the side effects of this drug and ask the patient, do you have cancer? And the patient says, I don't have cancer. That's your doctor is very serious treating for cancer. But drugs again can be used for so many years. And for now, we have new set of drugs, biologics, and quite a few of them that we have. The one that is available in Nigeria is the very first one, the toxin. The other ones are not available. Is there a possibility of cure? Yes, there is a possibility of cure. Within the past 5 years, we have begun to show more hope than ever. When I was training as a rheumatologist several years ago, lupus was what HIV was like a death sentence, but not anymore. The earlier we make a diagnosis, and the earlier you refer to the appropriate specialist, and specialist who manages lupus and autoimmune disease is called a rheumatologist, not another doctor. Not another doctor. So it has to be properly managed by somebody who knows it. So now the two cells, the T cells, must present something to the B lymphocytes. Is the B lymphocytes that can also cause the harm. So what medicine has done, what rheumatology has done now, is to make the T and the B lymphocytes enemies of themselves. Because the T and the B lymphocytes must cooperate to cause harm. So what do? Harvest the T lymphocytes, take it to some factory that it is, label them into a receptor with something that type a sensor on the T lymphocytes, and then take them back inside the person. That sensor is programmed to attack the B lymphocyte wherever it is. So rather than cooperating, you create enmity between these cells which are causing the harm. And this is now being known to be effective in lupus, in other connective diseases called scleroderma and what's called inflammatory stuff of the narrow progress. It is still experimental, and in medicine, once something is not yet completely documented, it's not going to come out. But there are people who are subjecting themselves to this particular treatment. It's not a treatment that you just dish out a drug. It's a very complex treatment, and it's been done in very few centers in the world. Very, very few centers in the world. And the cost is a bit prohibitive. Those who are buying it have to spend between $80,000 and $100,000. That's what it is. Now, the role of patient support groups, we need patient support groups because it's this condition that you need others here. Pastor Lilian, she runs a patient support group. Educate the patients. Rheumatologists may not be always the time to provide. Always have the time to properly educate. Then they're able to discuss certain personal matters like doctors are aware. They give moral support for patients. They will give financial support for patients. And over and above, they give psychology support. Let's is that the end? Let's slide. Okay, so this is the story. This is just like a brief on what lupus is all about. And so once again, let me thank for hosting that. I get to have small shops to take it. Thank you very much.